entering into this topic, I would like to tell that in Urdhwa Jatrugata Vikaras, the experience what I have is very minimum as compared to the sir. So whatever I have learned in 8 months when I was under sir, I would like to share the experience of that. There are few cases which I am treating in my clinic. I'll share those also. Okay. So let's start. So first, Guru Vandana to Dr. R.B. Gupte sir and Dr. Chandrakumar Deshmukh sir. So everyone knows, I guess, about them, but a brief introduction to them. So Vaidya R.B. Gupte sir was Guru of Vaidya Chandrakumar Deshmukh sir. So he was BAMS, MS, so Shalya, yeah, Shalya postgraduate. So he was so practical that he used to not take a single step further before he gets any specific results and all. So what happens is, like, he used to tell, like, baap dikhao nahi to shraddh karo. So he's like, it's like, show me your father or do his shraddha. So show me the proof, or else I won't listen to it. And apart from that, he had a great knowledge in Dravya Guna. Whatever plant you tell, he used to know. Even very rare plants also. And apart from that, he invented this technique of Vidha Karma and Agni Karma, which was hidden in our Samhitas since many years. So all my namaskaras to him, and Vaidya Chandrakumar Deshmukh, who taught me this knowledge, that is Vidha Karma and Agni Karma. He is also well versed practitioner who sees or who consults around 500 patients per day. So he runs 4 OPDs. So every day in Chinswad, from Monday to Friday, Chinswad in Pune. So it starts from 12 p.m. in the afternoon till 12 a.m. at the night, midnight. So continuous patients will be there, and in between 8 to 10, he will visit R.B. Gupte sir's OPD in Pune city, which is in Nanapet. So he goes there, he sees around 100 to 150 patients over there. And every Wednesday, he conducts free camp in Gatha Mandir, where around 200 to 300 patients come and take free treatments of Vidha Karma and medicines too. And finally, he practices in Nanded also. He is a visiting consultant over there, and every 15 days once he will visit there. So in that 2 days, Saturday and Sunday, he will consult around 700 to 800 patients minimum. So why I am telling this is because we as Ayurvedic practitioners can be successful by practicing only Ayurveda. So this has means many people will be having doubt that what if I won't like only practicing Ayurveda, will there be any like profitable business or profitable so that I can survive in my own lifetime. But and with that doubt, people shift to modern medicine. But when you trust your science and when you trust what you are doing, it will yield you the results. Okay, this we can take a great inspiration from the Chandrakumar Deshmukh sir, who is an excellent practitioner. Okay, so before that, I'll just give a brief introduction to what is Vidha Karma and Agni Karma. So before starting, why should we practice these two things? That is, first Vidha Karma. Why? Because it is a type of Sira Veda. Type of Sira Veda. So Sira Veda is told as Ardha Chikitsa, right? So almost half of our chikitsa is done by doing Vidha Karma, and it takes minimal time, small space, large setup is not needed, heavy investment is not needed, and it is very cost effective, and it gives very immediate results. So where are the references of Vidha Karma and Agni Karma? So mainly in the chapters of Siraveda Vidhi Sharira, in Sushruta, Ashtanga, and in Ashtanga Hridaya and Sangraha, and there are scattered references all over the Samhita. So main roots of the references are these four chapters, and there are scattered references all over the Samhitas. Like while explaining the chikitsa for the disease, they have told there and there itself do Sira Veda or do Rakta Mokshana or do Vyadhana Karma in such and such particular places. So basically, roots are these four chapters, and all the Samhita tells about where and when to do Vedhan Karma or Sira Veda Vidhi. So coming to review of literature. So what is Vidha Karma? So Vidha Karma, Vidha, the term means it is to do chidra, chidritaha, to puncture. So that is Vidha. And Agni Karma is like Agnina Krutva Yat Karma is Agni Karma. So here, whatever karma which when done by using Agni is called as Agni Karma. Sorry. Yeah. So before performing Vidya Karma, you should have this three knowledge of these three basic topics. First is Marma Jnana, Sharira Rachana Jnana, and Modern Anatomy. So why I have kept Sharira Rachana and Modern Anatomy separately, I'll just explain in further slides. So first, Marma Jnana, as everyone know this, Bhishma Pitamaha lying on the death of arrows. So many arrows were shot at him, but still he was not dead. This was because one explanation was because the arrows were shot in such a way that marmas were kept into the consideration and then shot at him. So hence the importance of marma in our sharira is sin. Sins are ancient age. Next is the most important pain marma in pain management. So people usually or patient usually comes to a doctor when he or she is in more pain. So the most widely used marma for the pain management is Kshipra marma. So Vyadhana about 2 angulis above the Kshipra marma is told. But what exactly is Kshipra marma, we'll see here. Tatra padasya angushta angulyayor madhya is Kshipra. So wherever the junction of angushta and anguli, the junction of these two is called a Kshipra marma. And if Vyadhana happens to this marma, what they have told is Akshepana and Marana. So Marana due to Akshepana. Akshepana is attacks, like epileptic attacks. So in the same way, Lord Sri Krishna had got hit on this same Kshipra marma, due to which he had epileptic attacks, and at the end he left this world. It is told like that. So other important marmas where in this Urdhwa Jatrugata Vikaras you need to know are Shankha marma, Sthapani marma, Vidura marma, and Apanga marma. So importance of Sharira Rachana. So we know that there is a one chikitsa for Visuchika is that do Agni Karma on the Parshne Daha. So why it is told on Parshne Daha? So and if we do Daha on that particular place, we will see the result immediately. So why it is told is because see, when Parshni is a place of Asti, and Asti when we see that is Astidhara Kala. So Astidhara Kala is also known as Purishadhara Kala. They go hand in hand. So when we do Agni Karma on Asti Dharakala, it will act on Purisha Dharakala automatically. And hence, it is told that Parsnar Daha, when we do, immediately the what you say, Drava Mala or the Drava Mala is going out, it will stop immediately. This once like while my sir was learning under Dr. R.B. Gupte sir, so he asked, sir, how can we come to know that whether it is stopping the drava from in the intestines or in the pakwashaya? So Dr. Vaidya R.P. Gupte sir told, let me, so remember, ask this question while we do appendicectomy surgery. So, okay, one fine day, everyone went to appendicectomy surgery, and sir asked the same question. So, that time, R.B. Gupte sir told to do cautery on the parsni. So, when the parsni, the dahana karma was done on parsni, immediate there was seen a contraction of intestines in the abdomen, and whatever the blood was flowing out while surgery, it immediately stopped. So that fast treatment we have in Ayurveda. And if we see this in modern aspect, there is no as such connection apart from what we see in our Sharira Rachana. Hence, I have kept it separate. And why modern anatomy is basically we need surface markings while doing Vidha Karma. So, when suppose in not in Urdhwa Jatrugata Vikaras, but other Vikaras where there is a frozen shoulder or apavahuka. So there they have told Amsayor Antare. So where around the shoulder. So that time, depending on the injury or depending on the immobility of the shoulder, we fix the point where to do Vidha. So it might be on the upper border of the trapezius muscle, it might be in the acromion notch, or it might be somewhere around deltoid muscle. So based on that, we decide where to do Vidha. So before that, we should know what are the surface markings over there. So modern anatomy and nerve supply to the different organs also. So which nerve, which vertebral nerve or which cranial nerve is supplying which organ, you should know properly. So do's and don'ts before starting you should know. So first is don't try if you don't know. Don't use in too old patients. So the next three, what you say, do's and don'ts are told for Siraveda. But while doing Vidha Karma, we don't take so much of blood. So these can be done in those conditions also. And don't use in the place of Marma, they are telling. In Ashtanga Hridaya, they had told that if you don't find Sira in that particular place, they are telling leave that. So in and around, if there is a marma, leave that marma, and like around the marma, you should do Vyadhana Karma. So where else the reference is seen? So in Chinese medicine, they are told like acupuncture and moxibustion are the alternatives or similar treatment which we see in Chinese medicine. Only so acupuncture is the where they use needle to prick at specific point and they treat the disease. But only the difference in between acupuncture and Vidya Karma is Vidya Karma has hollow needle, what we use, and but acupuncture is having like there is no porosity or hollowness in that particular needle. Coming to Vidya Karma, it is explained for both Vedana Shanti and Roga Shanti. So what and all do you need for Vidya Karma? Need needle number 26.5, needle number 24, cotton and spirit. Then pramanas they have told in specific pradesha only so much deep you have to insert the needle. So most of the time it is half reheat. So why like we are using this 26 and a half needle is because the length of this needle is equal to one vrihi. Exactly, it is approximately 11 to 1 vrihi is approximately 11 to 13 mm, and same length is seen for this 26 and a half needle. Hence, we use 26.5 needle. And why 24 number needle is because it is 2 vrihi. In some places, we need to insert a needle 2 vrihi praman. That time only we will get results. So, hence these two needles are extensively used in Vidha. What is expected when Vidya Karma is performed? So it is told that Tatraya Sukshma Shastra Vidhaya Avyakta Asrit Sravati. So whether it is Vyakta or Avyakta, Alpa Vyakta or Avyakta, the doshas will come out. And yes, what the reference I was telling is this one, Yathoktanim Adarshane. So when we don't see a sira in that particular place, मर्महीने यथासन्ने देशे अन्याम वेदेत siram. So leaving that marma, other siras around in and around that place we can do vyadhana. But sometimes what happens is we won't find any siras in and around um, uh, that particular place. So whatever is explained in our Samhita, suppose 4 angul is above Janu Sandhi, 4 angul is below Janu Sandhi, but there is no particular sira found in that particular place. So we have to just do Vedana Karma of half Ri Pramana wherever the Acharyas have told the uh, site. So that is the what you say meaning which we have taken. We have to take. So Agnikarma again it is explained for two Vedana and Roga Shanti. So types of Agnikarma are Tvagdagda, Mamsadagda, and based on Dravya, it is Snigdha and Ruksha. So Tvagdagda and Mamsadagda we usually see during either in cosmetic Agnikarma or while removing the corn or all such these things. But based on Dravya, mainly we do when we do Agnikarma with Swarna Shalaka, or when we do Agni Karma with Guda in frozen shoulder, when we do Agni Karma with Mritika Shalaka in calcaneum spur. So based on Dravya, it will be the Snigdha or Ruksha. So instruments needed for Agni Karma is first the what you say Pravara or Uttama Shalaka, Swarna Shalaka, then next Mritika Shalaka, Loha Shalaka, and Tamra Shalaka. Tamra Shalaka mainly used for cosmetic Agnikarma where moles, skin warts, skin tags, etc. are removed. This is why because the Dravya, Tamra, is Tvacha over there. And Tvacha, and it helps in developing the Bhrajaka Pitta wherever we do Agnikarma. So there is minimum scar or we can say no scar seen on that particular place when we do Agnikarma with Tamra Shalaka. Then rules for Agni Karma. So as such, there is no specific rule. First, but they have told that Atyugru Ruji Vayuhu. So wherever there is excess pain in that particular place, we have to do Agni Karma. And other place they have told is Uchrita Kathina Supta Mamsa. So wherever there is a tumor like growth, you can do Agni Karma over there. And various diseases they have told are like Granthi, Arsha, Arbuda, all those things where you can do Agni Karma. So Urdhwa Jatrugata Vyadhis, though before going to this, I'll tell, see, Vidha Karma is mostly used in almost 50 to 60% of the time. We use Vidha Karma to treat Urdhva Jatrugata Vyadhis. Yes, Agni Karma is also there, but I'll tell whenever I explain those Vyadhis, okay? So first, going to Jivha Roga, Mukhapaka and Dantashula. So all these three Vyadhis, we do Vyadhana Karma below jihva rogeshu adho jihvayam danta vyadhishu cha. So in all these three vyadhis, the what you say Vidha karma is done in uh, adho point. So how to do Vidha, and what is the what you say placement of the jihva patient? It is told that unnamita vidashta jihva agrasya adho jihvayam. So we should ask to lift the jihva. The agra bhaga should be placed on the talu, and we have to do with the below the jihva. So exactly we can see in this video. This video is where Dr. R.B. Gokte sir is only performing, and you can see just here the what you say there is a vein, deep lingual vein. Medial to that you have to do Vidha. So there is a vein, and in between there is a frenulum of the tongue. So wait, I'll just show. So this is frenulum of the tongue, and somewhere here there is a lingual vein, deep lingual vein. So in between this we have to do Vidha. Medial to deep lingual vein you have to do Vidha, and lateral to medial to deep lingual vein and lateral to frenulum you have to do Vidha karma in all the rogas where mukhapaka, jihva roga, all kind of jihva roga, dantashula, even the pain, extreme pain in tooth can be reduced by doing this Vidha only. Again, in dantashula, one more Vidha we see in practice is that you have to do Vidha on the danta mamsa, on the gum, where the shula is present, like which teeth you have pain, just above that on that particular gum only we have to do Vidha. Immediately the pain will stop. So before that, I had one case of what you say there was a swelling under the jaw bone. So mandible, under the mandible there was a swelling of around 7 centimeter long. So and the patient was like it is seen heavy, and I was she used to tell I am having more of salivation in my mouth. So I told okay we will do the Vidha and we'll see how it will be reduced. And apart from that, I had given some Shamana Aushadis to her. So within 3 sittings of Vidha, the swelling or the tumor-like growth came down to 3 centimeters within 2 to 3 days of Vidha. So that fast the Vidha karma acts. So next is Nasa Roga. In all type of Nasa Roga, there are 2 points. One Nasa Agre, Gandha Agrane Nasa Rogeshu cha Nasa Agre. And one more we take is Upanasika, just beside the nose. So that is Upanasika point. So first we will see Nasa Agre. So all the videos which I am playing here are done by Vidha Gokte sir only. He is so accurate. See, sorry. Yeah, here when you see, he has inserted Ardhavrihi Pramana needle on the tip of the nose. And before that, if you have observed it or not, I don't know, but see how he inserts. He pinches the tip of the nose and then inserts the needle. That is very important. So these minute observations are very important while practicing. this Vidha karma. So when doing Vidha karma on Jihva, you should ask patient to lift the tongue. You should ask patient to touch the tip of the tongue to their palate and then do Adho Jihva Vidha karma. Whereas in Nasa Roga, you have to pinch this tip of the patient's nose and then insert the needle. Only half Vrihi. If you insert Purna Vrihi or one Vrihi, there is a high chance of injuring back's plexus over there, and heavy bleeding might occur. So only half Vrihi we have to insert over there, not more than that. Be We have to be more careful while doing Vidha karma of Urdhva Jatrugata because it is done to for mainly Indriyas, and Indriyas are so precious to human body. Yes. So again, next is Hanu Vidha. Hanu Vidha, like it is except for Rohini, all Gala Rogas can be cured by this Vidha. It's just above the Adam's apple. See, sir is palpating Adam's apple over here, and just above the Adam's apple, we can see he is doing the Vidha karma. See, sterilization is done, and then the Vidha karma half Vrihi just above the Adam's apple is to be done. So except for Rohini, all other Gala Rogas can be cured by this. So this we use for Kasa also. So when we see there is some Shukapurna Gala, so there is kitch in your throat, or there is some what you say disturbance in your throat, we can use this Vidha to immediately get relief from that disturbance or from Kasa, or we can use this Vidha for hiccups too. The Hikka Roga, we can use this Vidha too. Then coming to Karna Roga, they have told Karnayor Upari Samantat, Karna Shule Tat Rogeshu Cha. So in Karna Roga, there are mainly 2 points. One anguli below the Vidura Marma, and one more Karnayor Upari Samantat. Karnayor Upari Samantat, like exactly what you say above the 1 second. Yeah. Karnayor Upari Samantat, Karna Paschat. They have told. In Tika, they have told Karna Upari Samantat, Karna Paschat. So behind Karna and above. Behind and above. Exactly when there is a Sandhi of Keshanta. So exactly where you can see. 1 second. See, exact. I'm sorry. See, exactly the point. This point. Just behind the Karna and above it. This is Vidura Marma. 1 anguli below the Vidura Marma is another point. So there are many patients where there is an insertion of grommet in kids, especially where there is a deafness seen, and they tell like to do surgery of around 10 to 15 lakhs, and they insert a grommet in the middle ear, so that we can prevent or that we can stop by doing this Karana Vyadhana. And yes, this Karana Vedana, this Vidha karma should be done for minimum 6 to 8 months to get beautiful results. So there are many kids in such clinics who has regained the hearing loss, whatever they had regained. They are able to hear now, and they are slowly learning to speak because when you hear, you learn to speak, right? So this Vidha karma behind the karna. One is karnayor upari, karna paschat, and one is one anguli below the vidura marma. So all the karna rogas. One more case I had was at night I had got a call where the child was not sleeping because he had excessive severe pain in ear. So before that, I told child's mom that please uh, uh, please put 6 to 7 drops of warm oil in his karna. Child was around 7 to 8 years old. So she put, but still she didn't get the result out of it. Then again she called at night. So then I went and just did the with the karma on these 2 points. Immediately the karna shula came down and he went to sleep. So that is how it works. Okay. So now coming to netra rogas, for most of the time we get adhimanta and abhishanda. So where they have told siranam sira mokshanam yojayat, they have told in this treatment part of the adhimanta and abhishanda. So sira moksha, where in tika they are telling upanasika lalata apanga. So this sequence you have to uh, follow in these adhimanta and abhishanda. So there are 4 types of adhimanta and 4 types of abhishanda. So in all those things, these sequence upanasika, that is just beside the nose, lalata and apanga. So these sequence you have to follow. The importance of sequence is very important while curing the ENT diseases. Not only in ENT, in every cases you need to have a proper sequence and exact vidha on that particular place. Then coming to Akshipak, where we can correlate it to conjunctivitis, where it is Sashofa and Ashofa. So they have told again Vidhva, they have told Sneha Svedopapannasya Tatra Vidhva Siram Bhishak. So Vidha karma has to be done in this also. But here, note it, here the sequence is different. Apangyam, Upanasika, Lalata. Whereas in previous it was Upanasika, Lalata, Apanga. Yes. So this sequence, what they have told, is utmost important while doing Vidha karma. So why is this particular sequence told? Is because it's based on the patala involvement of the akshi. First prathama patala, dvitiya patala, tritiya patala, chaturtha patala. So all these patalas what are explained in Ayurveda, it's based on that, and hence the sequence vary. So I have taken these 2 examples just to tell that how important the sequence is in different vyadis of akshi. So there are how many? 15 vyadis of netra where we can do with which are Vedya sadhya vyadis. That is, when it can be done, it can be treated by doing Vyadhana karma. Uh, Vedana karma. So before that, apart from this, there is one more vyadhi where other vyadhis like trigeminal neuralgia, where there is excessive tenderness or excessive pain in forehead, eye region, and cheek region. So in such cases, we can do this. What you say? Vidha karma and Agni karma according to that. Then coming to the main or in general shloka where they have to explain Vidha karma. So this is the reference is Shushruta Sharira 8:17, where they have told the Vidha karma for Vidha karma or Shira Vyadha for almost all the Ashtangas of Ayurveda which are explained. So here where we can see Timira Akshipaka Prabhutishu Prabhutishu Akshma Yeshu Upanasika lalatam apangyam va. So here see, when we see in Timira and Akshipaka, Upanasika, Lalata and Apanga. And then you can see Gandha Agrane, Nasa Rogeshu, Nasa Agre, Taluni. In Talu Rogas, you should do Vyadhana Karma in posterior one third part, where all the Talu Rogas can be taken care of. So Taluni, Talveshu. Then Karna Yopari Samantat, Karna Shule, Tadrogeshu. In all the Karna Rogas and Karna Shula, we should do the Vyadhana over here. So again, Jihva Roga, Adho Jihvayam, Danta Vyadhishu cha. So in all these cases, we have to do Vedana Karma over here. So this shloka is a base for Vidha Karma which we can do. So before going to case discussion, what is the role of Agni Karma here? I will like to explain over here. So in case of Danta Krimi, what we do is there we use wax or madhuchishta. We take it a little and place in the cavity where the cavity has occurred in the tooth, and then we heat the shalaka and melt that wax in that particular cavity. So 3-4 days we do that. With that, what happens is all the krimi which is situated in that particular danta gets attached to that particular wax, and that wax falls off. So after few days, the shula which the patient is experiencing goes down, and after that we use laksha. Laksha is certain drug where when we do purana with laksha in that particular cavity, it's very difficult to what to break it. So it can once if it is done properly to fill like what we see, we see like nowadays they put a particular time of cement in the cavity and they seal off the cavity. But in Ayurveda, they have told to use laksha. So laksha is used only when the krimi of that particular danta is eliminated out. Till that time, you have to do what you say madhuchishta agnikarma in that particular cavity only. So after that krimi is gone, then purana with laksha. Laksha you have to take and keep it in that cavity, red hot the shalaka, and then melt that laksha in that particular cavity. And once it sets, then only red hot shalaka will be able to remove it when necessary, or else no other instrument will be able to remove that laksha which is situated in that particular cavity. This is what explained in our Ayurveda. Such a hard substance it will become that it will take a red hot shalaka to remove it from the cavity. And apart from that, as I said, in trigeminal neuralgia, where there is a excessive pain in over the trigeminal nerve endings or trigeminal nerve path, that a person will not be able to will not allow a doctor to even touch that particular area. So in that, first Vidha Karma on the particular site, and then we have to do Vidha Karma, Agni Karma on that particular nerve path. Yes. So case discussion. See, I have very few cases, and among that, this one I have what you say. I'm documenting. This is a recent case which is going on right now. Hardly 3 days, I guess. Not day before. Yeah, day before yesterday, this lady came with a conjunctival hemorrhage. See, you can see the first day the photo where there is a redness all over the eye. You can see, and this is second day after first Vidha. So after doing one Vidha, you can see there is a whiteness which is emerging. over here. And the third Vidha, you can see further it is going on like reducing. See, the whiteness of the sclera is increasing. So here I would like to show that, sorry, yeah, the Vidha was done on Bhrumadhya, Apanga, and Bhrupucha only. So before that, I'll just explain in general Vidha which we do for eye related disorder. So it is Bhrumadhya, Apanga, and Bhrupucha for almost all the conditions in the eye, and Upanasika we take it only when there is a Drishtigata Vikara seen in the eye, only when there is a disturbance of Drishtigata Vikara. So person is not able to see properly, that time only we take Upanasika. Just exactly this point. Hope my cursor is visible. So exactly this point is where, see, this is Upanasika, this is Bhrumadhya, Apanga. Apanga is one anguli above the Apanga Sandhi. You can feel there is a notch or there is a groove over there. Exactly in that groove, we have to do Vidya Karma and Bhrupucha. So in Prathama Gata Patala, we do Bhrumadhya Apanga. Only two. Dvitiya Gata Patala, Bhrumadhya Apanga Bhrupacha. And apart from that, if at all there is something complicated, this thing cases where ear other sensory organs are involved, we take Shankha also. So these 4 points like Bhrumadhya, Apanga, Bhrupucha, and Upanasika are to be considered uh, during, sorry, during Vidha Karma of the Netra Roga related disorders. So this is a general thing where how the Agnikarma and Vidha Karma works. This we can skip. So conclusion is like we need that Vidha Karma and Agni Karma is, we see it is boon for Ayurvedic fraternity where when accurately done, it acts as a catalyst in chemical reaction, helps healing faster. So in some cases you can see only by Vidha Karma we can see results. So what case I had shown, this case, I am doing only Vidha Karma, nothing else. Only Vidha Karma just by 3 sittings. So first sitting is this, second sitting is this, third sitting I will see on Monday. So only in 2 sittings you can see the varied changes. So only by Vidya Karma you can see the change. One more case I have. The patient didn't allow me to take her what you say opinion, but I'll explain that case. Patient was having severe anosmia since 10 years. Since 10 years, she has not smelt a scent or any dirty scent of any garbage or beautiful smell of a flower since 10 years. But she came for something else to me, like for Pratishyaya she had come. So I did Nasa. See, they have told in Nasa all the types of Nasa Roga, Nasa Agra and Upanasika we have to do. So I did that, the Vidha Karma and Agni Karma on that particular points. After doing it for 2 sittings, she told, "Sir, while yesterday while doing taking bath, I was able to smell my soap. So is it because of this?" So even I was surprised that the person who was what you say not able to take a smell or not able to recognize the smell since 10 years is now able to recognize the smell whatever she like she smells the product or any kind of smell, she is able to recognize it. So that beautiful and that fast it acts. So Ayurveda has such beautiful treatment procedures. We, as Ayurvedic students, I'm telling students because even every doctor learns every day. So we all are students of Ayurveda. So we as Ayurvedic students, we need to explore Ayurveda more and more and take out such effective, what you say, treatments to the people. We have to bring all such effective and fast acting treatments to the society. Yes. So concluding to my session, so if till when it has to be done, it is told that in Vata Vyadhi they have told mainly you have to do Rakta Mokshana till Kuriyat Yavadatandrata. So until you get the desired, what you say, result, you have to do the Vidha karma. So minimum 3 sittings needed to see slight changes of in chronic diseases. We can see in acute conditions or emergency condition, fast effect is seen. So one case of, what you say, injury was, had come to me, where a person had fallen, and at the same on the same day the patient was hit by a cow. So I did with the karma, and within 2 days, she was able to walk properly without any internal medication. Yes. What is beauty of Vidha karma is it can be done every day. Unlike Rakta Mokshana. In Rakta Mokshana, we have to give some gap. And every Ayurvedic Vaidya should have these skills, and hence we are promoting this beautiful skill on this platform. So, thank you. So before concluding, one more case. Just now I remembered, one old patient. He underwent surgery of a right eye, and after surgery, he saw that whatever he was able to see before surgery, after surgery is not able to see that particular vision also. So the vision was deteriorating. So after few days, he had a complete loss of vision. So now it's been around 3.5 months. The person is coming. That person is coming every day, doing Vidha and going. So now when I ask him, he tells that, sir, before that I used to, before starting this treatment, I used to just drive my vehicle by using my one eye. One eye was completely blind. I was not able to see a light also from that particular eye. But now he says, I can see there is a brightness when there is a light. I can see the brightness which is visible, and some shadows I can see by when a particular object is coming in front of that eye, I can see the shadows in the bright light. So that effectively only with the karma. Okay, I'm not giving a single drug into to him to take internally or doing any other local, what you say, the kriya kalpas to that particular person. Only with the karma he comes, he takes with the karma and he goes. That's all. Every day he comes without fail, and this is the result what I am getting. I'm gonna publish once that case is completely finished. Till that time I thought that I'll keep it, I'll not publish or I'll not take the person's review from that. So thank you. So for further any queries or any details, these are my contact details. I stop over here. Thank you. Yes, any doubts you can ask me. See, I could not show you much cases, because even I am learning, I am exploring this particular field in Vidha Karma and Agni Karma. So I didn't show you much cases. Normal pain related cases I have many, but in Urdhwa Jatrugata, yes, I'm not that experienced, but still I'm learning. Yes.
Sir, is it possible to do Vidha Karma for ulcerative colitis, sir?
Sorry.
Vidha Karma and cure for ulcerative colitis, like having a stomachache on the early morning there just before defecation.
Yeah.
Such patients?
Basically Udara Shula, right?
Udarashula, sir.
Yes. So basically, it's based on. See, this is first of all, it's not coming under today's topic, but still, I like to explain you.
Okay, sir.
It's basically, see, if it is above Nabi, we just take a point below xiphoid process of sternum, or
Okay, sir.
else if it is below Nabi, we take medially to like we palpate the anterior superior iliac spine of the hip bone, and medially towards umbilicus, 2 angulas of that particular patient, and medially towards umbilicus we do the Vidhakan.
Just enter medial to the umbilicus and symphysis pubis, sir. Anterior
Yes,
symphysis pubis.
yes, not symphysis pubis, umbilicus and anterior superior iliac spine.
Iliac spine, sorry. Okay.
Yes,
Anterior
yes,
iliac spine.
yes.
Middle
How many
means I
days,
have
sir?
to take should I come to the level of the so the iliac spine, sir?
Sorry.
Should I come to the level of the umbilicus means below the umbilicus, sir?
Yeah, if the pain is below the umbilicus, so from if you draw a line from anterior superior iliac spine to umbilicus, so we will
Okay.
get exactly where the McBurney's point is, just below that,
Okay.
on both the
Okay,
sides.
sir. On both
McBurney's
the sides.
point is especially
McBurney's
on
point.
right
Okay.
side. So it
Okay,
is
sir.
on
Okay.
right,
Same
right
point on
side
the
only.
left side. If it is there,
Yes,
there also
yes,
just below that.
yes.
Okay, sir. Sir, this should be done till how many times, sir?
Usually, when patient comes with the Udara Shula, when you do it immediately, immediate relief can be seen. But apart from that,
Okay.
we should see what is the Nidana causing that.
Okay, sir.
Only if that Nidana is stopped over there, we can see the permanent results. Sometimes what happens is we do with the karma, but still the patient continues the Nidana Sevan. That time what happens is the recurrence of that particular Vyadhi is seen more.
Uh-huh.
Yes.
Okay, sir. Sir, return means like I've been told like eat only that vegetables and fruits which vegetables which come from the climbers.
Okay.
So the other fruits and all like non-veg and some other hard to digest such things will make the nidana, no, sir?
Yes. Basically, Agni plays the role. If Agni is good, everything
Mm-hmm.
everything is digested, and that shula will not occur.
So patients are just before the defecation she has, that's all.
Yes. That also can be taken. It usually undergoes in Grahani Roga.
Okay, sir.
So Grahani Roga with Chikitsa, if we do, you will get the results.
Okay, sir. Okay. Yuddha karma same. This is the procedure.
Yes, yes.
Okay, sir. Thanks a lot, sir. Thank you, sir.
Hmm. Hmm. Sorry. Huh. 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 Yeah, together on the same day we can do it separately also. Like certain cases where we need only Vidha karma, certain cases where we do only Agni karma, or certain cases are such that we do both. So first we have to do is see whether the condition is Sama or Nirama. So if Sama is present in the patient, then the Vidha karma is contraindicated usually, where Agni Karma plays more vital role in treating that particular disease. Especially when I give a exact example of Amavata. So in Amavata, when we do only with the karma, patient next day comes with severe pain. Whereas